Hey, Dr. Bill, excited to have you on the podcast.
Thank you so much.
Great. Well, if you could really share your journey about how you came to do this work. I know you've got quite a lot of different kind of avenues here that you're doing. So excited to kind of learn how you came to all of that.
So briefly, I'm an immigrant. I've lived in this amazing country for now 50 years. I grew up in Ohio. And then after my undergraduate education, I went to Columbus for medical school. And then I came to Boston, a mecca of medicine for training, and I stayed. And I'm often asked, how did I become an OBGYN? I'm not really sure if there's a one answer. I always like to start with the fact that my mother was just 15 when she got pregnant with me. She had me at the age of 16. This was just a few years after Korean War ended, and being young and poor, she had no prenatal care. I was born at home without an attendant. Fast forward, here I am in Boston. I think when I think about what I wrote for my essay for medical school, I think I started with a sentence that said, I just want to help people. And I think I'm very fortunate in that after all these years, I still feel the same way. And in just matter of a couple of months, I will be done with my last delivery. Just the thought of it makes me very emotional. But after 30 some years and after over 200,000 actual patient encounters, I think it's time for me to really try to make a difference more than just one at a time, which is why I've started with podcasting, which is why I'm here talking to you, in that I think for a country like ours with so much resource, we're not really supporting women, period. We're so far behind other countries. And I think it's important to let women know what's going on and think about alternatives, which kind of fits your podcast.
Absolutely. Yeah. And so obviously people that are listening to us, they're on the fertility journey, trying to conceive. Many of them, had failed IVFs, or they've, been told donor eggs are their only option. Been many trying for years. Other times people might just be, started trying, maybe it's been 6 months and, they're 35, they start, looking into things, or under 35 and they've been for a year, and it's like time to get some tests. So typically the first point of contact is your OBGYN. So what are some kind of, someone comes to you and they, they're struggling to conceive, which seems to be, 1 in 8 couples in the States, 1 in 5 in Canada, like it's on the rise, right? So what are some things that you will look for when they first meet with you?
I think typically when a patient comes in and is talking about her struggle with pregnancy, what I really try to do with just any patient is really get to know them, make sure I understand beyond vital signs, beyond their medical history. Really, it takes a visit or two to get to know each other and then figure out what was done and what needs to be done. I like alternative medicine. And what I'm talking about is, aside from eating well, I believe in acupuncture, physical therapist, chiropractor, and other alternative therapy that many people don't think about. I just had a conversation with a patient today who's undergoing IVF, and I got a schedule for acupuncture before and after. I've also used herbal medicine. I mean, when we're talking about fertility, it takes two. And for men, it's very simple, semen analysis. For women, it's complicated. It's complicated because often what do women do? They internalize and they take the blame as to they are the cause for infertility. And often that's not the case. So I think it's important to really understand not just their history, but overall wellness. And it's not unusual for me to tell patients, maybe right now is not the time. Maybe we need to spend a few months to get you healthier, for example. My practice is unique in that all my patients primarily find me, which means I don't really know if I have very many 20-year-olds who are pregnant. I think most of my patients are 30s and 40s. Probably about a quarter of my patients are over 40, which means many of them have gone through some sort of fertility treatment. But I think it's so important to let women know that no matter how long they've been trying, supporting them, talking about all the options. I mean, I had a patient who she's been trying for 10 years, and I was lucky enough to be part of her first and only pregnancy. But, that type of journey is not unusual, especially now that women are waiting until much later to have babies. And it's so important that they are heard and they are supported, and not just with common routine diagnostic blood test, hysterosalpingogram to see their tubes are open, or ultrasound. There's a lot more than that.
Yeah, absolutely. Yeah, like what are some of the questions that you would kind of ask that might be different from your conventional, OBGYN that might just be focused in on some of the testing and referring you out and things like that. Like, so you're looking more at the overall wellness, sort of saying sometimes, at this stage, maybe they're in a high stress job, something that you're saying to kind of take some time to focus on your health, or like what are some of the questions that you're asking?
The reality is we're talking about a country which really does not support women. We also have so many women on medications such as medication for depression and anxiety. And we also have a good number of population really isn't healthy. So I think it's important to address overall wellness. And I really try to step back rather than talking about what kind of tests have you done, what is your menstrual cycle like. I think initially it's about getting to know the patient. What does she do for work? What is a typical day like? What makes her tick? What kind of job does she do? What about a partner? It's so important to get to know the patient and reassure them that they still have time to be tested, time to get pregnant. Too often when a person walks into an OBGYN office, it's just about, hey, tell me your menstrual cycle, and what was done, what's your medical history like, and let me schedule your blood test on day number 3. If not, let me check your AMH. It's too fast paced. And often, because patients have gone through lots of office visits by the time they get to a typical OBGYN office, they have to be heard. And we don't really listen to patients much. All the 15 minutes we have, it's just about asking questions one way without having a bi-directional conversation. So if I can let my patient know at the very first visit that because I'm sitting down with my legs crossed, I lean back and say, hey, just tell me briefly who you are and why now, what needs to be done. And having that few minutes of initial conversation was so far away. Because I got to make sure that my new patient is relaxed and comfortable enough to tell me her story, because it's just more than blood levels, right? This. It's too often in vitro fertilization or fertility treatment has become just a business. Whole medicine in this country is about business. Unfortunately, the recipients or women are not expressing enough of what's going on, rather than, for example, if you went to a hotel and you are checking in, you're given a room, and if the room is not what you signed up for, you probably would say, hey, this is not what I signed up for. I signed up for 2 beds rather than 1. It was supposed to have a balcony. That doesn't happen in the doctor's office. You wait 40 minutes, an hour, your appointment gets canceled, and then you are told that, oh, even though I had my medical records faxed, they tell you that they don't have it. So we now got to reschedule. Patients' time is not value. It's all at provider's term. And that has to change. And in Boston, there are so many fertility clinics. It's almost like drive-through. I tend to refer patients to smaller clinic where I know providers. Particular one in north of Boston, I know these providers for 20, 30 years. And I make sure that these patients take care of my patients well. And I don't think that happens often. Patients that just shoved from one office to another. And why? Because it's about money. Why wouldn't fertility doctors say, hey, you know what? I think your only option is maybe egg donor and fertility cycle. IVF, this isn't cheap. This is $20,000, $30,000, $40,000. And many of us, I know patients who are borrowing money from their friends and parents just to get this treatment done because they want to be parents. Man, we gotta be able to do better than that.
Yeah, it's like that was my next question about the business of IVF, because I see it all the time. Like people telling me, 7, 8. I just talked to someone who'd done 9 cycles in a row, like retrievals and transfers, and nothing worked, and no one stopped to look at her health. And she's a doctor herself. So we see many people that are, on that fertility journey, and they're super stressed and they feel very panicked. And, what is it they can do? And then, the fertility industry kind of perpetuates that panic of like, your eggs are too old, you're too old. Yeah, it is business, right? So the global industry is estimated that the fertility industry is estimated to be 25 billion, it's predicted to grow to 41 billion by 2026. So it's all about the Benjamins kind of thing.
I mean, medicine in this country is about money. It's not about patients. And particularly for women, we're talking about the only country without universal health care, only country without paid national maternity leave. And that's just two examples. There's so many layers. And why when women be stressed? They want to be pregnant. And the layers that they have to go through between insurance companies and doctors' offices, whether it's fertility, OBGYN, or primary, there are so many layers they have to jump through. It's unfortunate because I think we can do much better.
Yeah, and I'm in Canada, so we think that we've got this free healthcare, but literally it's a similar thing here where you go to the OBGYN, they refer you to the fertility clinic, you get one free one, one free IVF, which you probably got to wait a couple years on the wait list for. They tell you there's nothing you can do with your diet and lifestyle. That I've got people telling me they have one embryo left. They think it's their last hope of ever having a child, and just there's so much pressure put on themselves. And it's interesting in the Canadians too, where because there's something with our healthcare field where I'll talk to we have a lot of clients in the US. And people in Canada, somehow we don't really know our numbers. We're not given our blood work. We have to ask for our blood work. And from the doctor, where I feel in the States, just because of how things are, people are a little more empowered. And they if I can say, hey, what's this and this, and they can ream off all their lists. If I ask Canadians, they're like, oh, I don't really know. They didn't really give that to me. So there is some piece in there, but yeah, it's just feeling like there's no other options. And so I guess kind of like if someone comes to you, so you have a fertility clinic that you like there, obviously we're helping people get healthy before they go to IVF. We're not anti-IVF, we're pro-health. But I guess as far as referring someone off there, like when are you doing that referral for someone?
Usually, it varies depending on patients, but I try to get the initial workup done just because common, whether it's blood test and hysterosalpingogram, ultrasound, a lot of those can be done initially. And at the same time, by working with a patient over a few visits, I really want them to I'm not trying to brainwash them, but I want to educate them, to let them know that it's normal, it happens. And after a series of tests is done, I refer them to one particular clinic, particular doctor or two. And I tell them, sometimes it doesn't work out. Just because of your initial interaction, don't be afraid to say no. Hey, Chun, can you find me someone else? Because why wouldn't you? This is not just the cost. At the end, you'll be pregnant. And then the labor and delivery process takes you to that amazing life event. The birth of your little one is the most amazing life experience. And why would you not want to have that done according to you? I mean, I think, that life event is more significant than getting married or getting hitched, right? And whether it's Canada or US, people just don't do it just right. So in my office, one thing that all my patients have is they all get my mobile number. And what I usually say is, I have 5 kids, and because the age range from 26 to 13, my phone can never be off. So the same number is given to my patients. And having that peace of mind, really, I think is what separates myself from other practice. And all I'm saying is, whether it's fertility, primary care, or rheumatology, it's about communication. It's about having that feeling of trust, knowing that your provider is looking out for you. If you start with that, then people can deal with good outcomes as well as bad outcomes. So, such unfortunately, because again, medicine is business, not enough people are given that opportunity.
Yeah, it's interesting this with with when you're saying about the wedding piece. I remember having someone on my podcast years ago, and they said, why do we spend 12 to 18 months, preparing for the wedding, spending all this money on the wedding, and then month 1, we want the baby. Why don't we switch that around? Let's lay a strong foundation for our future generations. And why are we spending all this money on weddings? I saying that. I remember my mom saying, Sarah, you should elope. Why do you want the wedding? And I'm like, well, I thought that's just what we do. But right. So for me, I had the wedding and then the baby. I'm like, oh my goodness, was told, donor eggs are my only option. I had both my kids with, donor eggs. They're 18 and 21. So many years later, and then the same, if you get this 25 years later, it's the same, course of treatment. Here you go, donor eggs, nothing you can do. And we just know with functional medicine and functional nutrition, that's just not the case. It's very interesting here. The next question kind of about the business of birth, because so I'm like super tall, like 6 foot, slim build, all that kind of stuff. And then I went to have my daughter, and then it was like 18 hours of labor. She wouldn't come out. I remember the gynecologist, my OBGYN was at the bottom with the forceps, just like pulling on her. And then she wouldn't come out. And then they said, okay, we've got to go for a C-section. And so they're like, Sarah, you can cry at that point. And I'm like, can I? Okay. So then I was upset because it's like 18 hours, went through and had her through C-section. And then for my son, they said the same thing, because you had a C-section with the first, you've got to have a C-section with the second, which now I've heard is not the case, but I had no clue. I just listened to what, the doctor had told me. So can you you've got a lot of information there kind of about the business of birth, about what's like C-sections and forceps and maternity care, like where do you see the future? What's your take on all the stuff that's going on in the hospital settings with women?
At least in the United States, I have no good news. We already experienced significant shortage of OBGYNs, and that's going to only get worse. When I went through training, the C-section rate was 13%. 30 years later, is triple that. Now, if a hospital, like the hospital I work out of, probably C-section rate is 1 out of 3. Why would a hospital like that really try to come up with ways to reduce the cesarean section rate? It's very simple. The difference between 100 vaginal delivery and 100 C-section for the hospital is $2 to $3 million. $2 to $3 million is in revenue. So why would the hospital have any incentive? Let's talk about doctors. Doctors, we get paid more for C-section, probably about 10 to 15% more for C-section than vaginal delivery. And one thing we are very good at, we are so good at scaring you. I mean, I know this one doctor retired. He would tell his patients around 28 weeks, you know what? I think your baby's going to be big. So let me schedule a C-section before I go on vacation. What is the patient going to do? Oh, the patient likes the doctor, and the doctor is saying, oh, my baby's going to be too big. So she gets a C-section schedule. And then the second one, because some of the hospitals in Boston do not provide 24/7 anesthesia, vaginal birth after C-section is not an option. Why is that not an option? Because having 24/7 anesthesia coverage costs money. So if a hospital generates more revenue, if doctors make more money, what is the incentive to try to have vaginal birth after C-section? None. It's simple. It's money, money, money. Now, you mentioned forceps. God, the last time I used forceps, I think, was 30 years ago.
My daughter's 21, so yeah.
I rarely use vacuum. I have found that, when it comes to pregnancy, I am not, I'm more of a let Mother Nature do her thing. I don't induce a lot of people.
I was induced.
C-section is such that I probably have the lowest C-section rate and lowest induction rate in my hospital. Why? One, my patients have my number. Two, unless I'm traveling, I deliver all my patients. So my patients trust me. They know that unless there's a reason, I'm going to let them go up to 42 weeks. You broke your water. If your GBS is negative, I let you stay home for the first 24 hours. So things like that, as well as other medical conditions, rather than say for chronic hypertension, rather than induction at 37 weeks, I wait until 39 plus. I just had a patient 2 days ago, 39 weeks and 3 days, chronic hypertension. I brought her in. I think 6 hours of Pitocin. She pushed once and we had a baby. In other practice, she would have been induced 2 weeks prior, which would have taken 2-3 days. So why is this the case? Money, 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 which is the same reason why so many of us are on medication. Since the United States, along with New Zealand, are the only 2 countries where direct marketing of prescription drugs is allowed, we are on this medication. Why? Money. It's all about money. Unfortunately, because of that, women suffer. It's very clear to me. It's about money.
Yeah. And then so if you kind of share about the difference for the child, for the vaginal and the C-section birth, and how you're not getting the beneficial bacteria from the vaginal canal and all these different, things that happen for the children that are with C-section. I don't know if you can talk about that a bit.
Well, I think when we talk about the difference between the two, I tell patients vaginal delivery is like stepping off a chair versus C-section is jumping off a four-floor building. Such a significant difference for the mother in terms of morbidity and certainly mortality related because it's a big surgery. It's the most performed abdominal surgery in this country. So we have little under 4 million births, and 1 out of 3 are C-sections. So 1.3 or more C-sections are performed. In terms of for the newborn, certainly there are benefits of having baby coming through the birth canal in terms of helping with the respiration and whatnot. But overall, the problem is the C-section rate is just too darn high. I think something in low teens, maybe 10%, reasonable. But in our country, and I'm not sure what the C-section rate is in Canada, but we're never going to achieve those numbers. It's only going to get worse. And I don't know. I don't know what the solution is. Only thing I can do is just talk about what's going on and possibly come up with some solutions.
And then, so you have a foundation, I think that talks about that has doulas in it there. So, and I know, like 21 years ago and 18 years ago, when I was having my kids, like no one was talking about having a midwife or a doula. It certainly wasn't on my radar, or I would have had one. Because I remember at the very beginning, at the end, where I was, getting ready for birth, and I started panicking and calling everyone to help me with the breathing, because I got the breathing mixed up and I needed help. And so I was like so stressed about this. Then everything was fine. Then they gave me an epidural and I didn't need all that. So, but some more medication for me. But can you talk about what the role that a doula has with fertility and pregnancy, and kind of what you're seeing there?
So I started Doc and Doula Facebook group a few years ago because of pandemic. And I realized that a lot of my patients needed additional help more than what I can provide. The definition of doula is very simple. It's a lay person whose job is to make the labor and delivery process positive, and as well as supporting postpartum care. And a lot of women need a doula. I mean, I think the ideal obstetric model is using midwives, but the particular hospital I work out of, we don't have midwives. What I see doula is supporting women and filling the gap between myself and the patient. So, and the spin-off from that is, unfortunately, the cost of doula is anywhere from $1,500 to some of them charge $3,000. I know there's one in LA charges $5,000 for support. That's a lot of money. And women without financial means should not be discriminated. So we started a nonprofit where we support women who cannot afford, and we help them finance for doula support. I think at least in the United States, since there's no significant plan to increase the number of obstetrician or midwives, I see the doula as a possible solution. There's an excellent new program for doula training out of Colorado, which is I'm part of. They made it the training program so that it's not just the weekend, but it takes months. It also is a process for them to get certified. And I see this doula as being a real profession. Not only women will benefit, it could be a profession where many women may want to be, so that if they're doing 2, 3, 4 births a month, there could be a good income for them. And I think it'll affect not only labor and delivery, it'll help with the recovery. It may reduce postpartum anxiety and depression. Unfortunately, a lot of my colleagues do not support the concept of doula. I'm not really sure why that is. But I think doula is something that we should all look into. Fortunately, there are a few states in this country where Medicaid is paying for the cost, which is great. Medicaid being a federal government health program based on income. So slowly things are happening, but not fast enough.
And then what was the name of the doula certification place in Colorado?
Oh, why am I having I'll have to send it to you. Allo Doula Academy. I'll have to send it to you. I'm having a proof for it.
Can you? Okay, yeah. Let me know so we can add that in there. And so you've got here. So according to research, people who receive continuous support during their labor and delivery were more likely to have spontaneous vaginal births, less likely to use pain medication or epidurals, less likely to experience vacuum or forceps, assisted birth, and cesareans. Because they've got someone in their corner, I guess, to help them with the stress piece of this, and maybe, and as you say, that liaison between the OBGYN and the patient. Labors were shorter, babies were less likely to have a low Apgar score at birth, and women were less likely to report negative feelings about childbirth.
Well, childbirth, whether it takes place over a day or days, is certainly physical and mental. I think in addition to that, a lot of doulas are great in helping out postpartum period with breastfeeding as well as doing minor chores maybe. But postpartum period is not talked about enough. I mean, postpartum depression, anxiety, postpartum period isn't 6 weeks. It could be months, it could be 6 months, it could be a year. And at least on this side of the border, right? Many people go back to work before they are ready. So no wonder people are needing medication for anxiety and depression. But doula concept has been around for a while, but I initially became familiar with it when I was a resident. And for the past few years, I really became an active supporter of this concept because it's helpful and it works. And I think doula is becoming very popular in Canada as well because a lot of members are from Canada.
Yeah, and there's now fertility doulas too, so helping with the fertility journey.
Yes.
Because there's so much anxiety and worry during that, and then as we roll into pregnancy, to have someone by your side, which is like to help you. Sometimes we like second guess ourselves. We need like another advocate to be like, okay, trust yourself, and someone can say, yeah, trust yourself. And so, and then, yeah, like I just did a podcast episode actually about depression. We see this a lot with people that are on the fertility journey. Typically there's clinical depression, that they could be experiencing for the fertility journey, but maybe they had been experiencing depression and anxiety their whole life, which is a clue as to why they might not be able to conceive. We're looking at gut health and food sensitivities and digging deeper from a functional medicine and a nutrition standpoint. And then, and so you've developed a line here and sort of some things to help with people that are, I think, struggling with mood issues and more. So maybe just kind of talk about what you have going on there with women organics and how did you come to develop that and what does that look like?
So I became really frustrated with probably the only option I have for treating anxiety and depression, which are writing prescriptions, particularly SSRI like Zoloft, Prozac, Lexapro. The problem is that is not based on science. We oversimplify this idea of depression and anxiety based on simple chemical serotonin. It's chemical imbalance. It may be in a lot of medical conditions, but I think we are oversimplifying that particular condition. So it's like treating fever with Tylenol and saying, oh, let me give you Tylenol for fever. But what was the cause of that fever? Because we don't really understand depression and anxiety. That's the bottom line. So, and then what's my alternative? Because we know getting a therapy in place with mental health workers. It's great, but I don't know about Canada, but in this side of the border, we don't have enough therapists. People are waiting weeks and months, and many of them do not take insurance. So the good ones are charging $200 per session. Well, you need half dozen or a dozen sessions. Again, it's cost. So I was trying to figure out there's got to be more than what I have to do. And certainly I use acupuncture and other alternative medicine. And then I really became a student of CBD or cannabidiol, which is made from hemp. Since 2018, it has become legal in this country. So I became a student of this because it's a supplement. And unlike SSRI or other medications for mental health, side effects is minimal and you don't need a prescription. So I started women-only organics to address mental health, sleep, weight control, pain, as well as some additional products, mushroom products. So when I had a patient this morning and one on, what's today, Wednesday, Monday, soon after delivery, a woman, both of them, not breastfeeding, but they're really struggling with postpartum blues. What are my options? I talk about traditional option where, we can talk about medication, particularly Zoloft, which we use a lot for depression, or we can try CBD. So the reason I promote the supplement is because one, it's safe and effective, no significant side effects, and at least I know how patient will react. Versus medication like Zoloft, when I prescribe, I say, first 2 weeks, I want to make sure you don't have any side effects. And then second half of the month, I want to see if it's doing something because often it takes a month or two. And then significant side effects such as weight gain, decreased libido, and lots of GI symptoms. So now I say, you know what? There's option A, option B, and option C, rather than just having option A, which was just traditional prescription. And it's unfortunate because I think the FDA knows, I think a lot of drug companies know, that SSRI is not based on science. There's no science that says it's serotonin imbalance that causes depression. Yet, what happened? 1 out of 4, 1 out of 5 American women are on these medications, and many of them are struggling to come off.
Yeah, they're put on it for years and years, and I speak to them all the time where they've been on sleep aids for years because they couldn't sleep, and someone put them on a benzo, and next thing you know, they're on it for years. They were on Zoloft and more, and then they're trying to have their baby, and the mental health conversation in this country and that the world has improved, but still I think there's still obviously therapy can be part of it, but for functional medicine, functional nutrition, what's the root cause of this, of gut imbalances and sensitivities and chronic stress and hormone imbalance, all sorts of things, and you're throwing a medication at it, which can be part of the solution. It's not against it, but it's always it seems to be the first thing. Hey, go that, where there's other things you can do that aren't, be as detrimental to your health, because kind of taper off of that stuff can be brutal. So,
the main reason why that's happening is because it takes time to talk to people, and no one has time. No providers have time. You cannot go through all this in 15 minutes or 30 minutes, and appointments come every few months. I mean, around here, people are waiting for an appointment with a primary. They're like, okay, it's July. When's your appointment? Oh, I'm on the waiting list. I think mine is in December. 6 months for a primary appointment. Yeah, it's crazy.
Yeah, a specialist in Canada, good luck. Be waiting a year. Okay, and so what is there anything that you're personally obsessed with right now, from a book, a website, an app, a documentary, anything that you're just like?
Yeah, so I'm finishing up a book. Which says women's healthcare in the U.S. is effed up.
Yeah.
I talk about all the reasons and possible solutions. And what I tell patients is that information is power. Information is knowledge, the tools you need to make sure you're working with the right provider. I also say get as healthy as possible. It's not just the weight, but really being in a good place mentally, physically, and spiritually. And think about alternatives. It could be Chinese herbs, it could be acupuncture, and it could be CBD. So open and think outside the box about your alternatives. So as I approach my last delivery in August, I'm going to be spending my time on podcast recordings as well as doing more social media lives. It's all about education, letting people know that I'm going to bring information to them. I'm also going to make myself available for questions and answers. So rather than staying up all night and delivering babies, I'm going to sleep during nighttime, and daytime, I'm going to talk about all of this. And I believe we haven't made enough noise about what is going on. And maybe in Boston, a mecca of medicine, we have more options. But if you go to certain parts of the country, like Louisiana, Mississippi, and other states, the statistics are sad, really, really sad. But they have internet like we do. And hopefully I can connect with a lot of people over internet and let me provide information to you. As far as the CBD is concerned, I named it Women Only Organics because I'm an OBGYN. My only interest is women. I don't know anything about men or pets. So our products for women. And I think what we are providing is a place for women to come and get information. Even for CBD, every person who makes a purchase, if they want, they get my mobile number because I want to make sure that their needs are met. I want to make sure they're taking it the right way. I want to follow up, and I'm trying to make sure that women benefit rather than making a sale. So I tell you what, so many people think that CBD is marijuana, which it isn't.
Nope.
And either people use CBD or people don't know anything about it. There's like no in between. So I've been having really pleasant experience so far because a lot of women are losing weight. People are replacing their SSRI with CBD. They're sleeping better. And overall, it's been a very positive experience. And for someone like me, I'm a Western trained physician, right? I was educated here. I'm board certified. I follow American College of OBGYN. But I want to tell American College of OBGYN as well as Fertility Association, everyone else who listen, we have to really figure out what to do because we're in a big trouble. There aren't enough of us to look after women. And especially with Roe versus Wade being reversed recently, the training spots are in trouble. And I don't know what women are going to do, especially if they live in certain parts of the country.
Yeah, it's sounding the alarm, right? To look at things differently. And And there's things we can do, which are positive side of things. Take your health in your own hand and choose a provider that's going to think like you do. And if they're telling you to do something that doesn't feel right, then be your own advocate and trust yourself is kind of what I believe. So, or definitely what I believe. Any final thoughts for us here, Dr. Bill? Anything you want to leave us with?
Well, I want to tell you that I enjoy a lot of your podcast. It was very, again, because your approach is such that you are allowing people to say, they're normal and there are options. It's not just what they're being told. So thank you so much for doing all those podcasts. If your listeners are interested, they can visit Women Only Organics and use Fab Fertile 30 as the discount code. And I can send you the code to your email so that they can use it to get some goodies. The thing I want to say to all of your listeners, if you're interested, if you have any questions, you should be able to find me, if not on this podcast or on other social media outlets. And I'm happy to answer all your questions. And I really get a kick out of the fact that I have patients from not just United States and Canada, but from about 70 countries around the globe. And I use WhatsApp a lot, as well as other apps to communicate. So just reach out, ask me, and I would get back to you.
Love it. Thanks for that code. So Fab Fertile 30 and Women Only Organics. And just for someone on the fertility journey, what's your take for CBD? Is there anything you would caution them on that, or like before the cycle, or anything you'd say on that?
Yeah, I think you can use CBD product to get healthy for sure. And certain CBD products I think are fine during pregnancy. Yeah. The fact that, if a patient asks her doctor, can I use CBD during pregnancy? She'd probably be told that there's no data. We don't have data on a lot of stuff, but at the end, it's your choice. And I think depending on indication, some CBD products are safe and useful, especially for sleep.
Yeah. Mm-hmm. Awesome. Great. Well, thank you so much for your words of wisdom and sort of like sounding the alarm and giving us some solutions. And thanks for coming on.
Thank you so much, Sarah.